Good morning. How's everyone doing today? Welcome to the first Wine and Wellness Week of 2015. My name is Jamie Dorley, and I'm going to kick off the workshops for the week. I come to you with starting my 26th year in the wellness industry. Started back in 1988. Can't hear me? Can you hear me now? Is that better? Okay, be a good commercial, right? So I started in 1988 helping people in college get on fitness and exercise and lifestyle programs. And after 25 years, I'm here today to start off the Wine and Wellness Week. Who has been to a Wellness Week before? Welcome back. We do these 5 times a year at this location. We also work with other healthcare professionals in the area doing these type of events. Who's here for the first time? Oh, great. Welcome aboard. So what do you get when you come to the Wellness Week? You get free healthy food. Anyone try the food? We're doing free demos today. And today we're doing the Oligo scan, which is heavy metals, antioxidants, and mineral testing. It's all free. We do 35 workshops this week. We have healthcare professionals to answer any questions, free literature, free samples, free smoothies. And the only thing you need to do, if you buy anything, you qualify for nice discounts. Sounds like a pretty good deal, right? So what do you need to do? You need to come and bring somebody next time, right? It's the only thing we ask for. And then we can continue to do these events because they've been very helpful. Because the goal of our program is to get you healthy and then to keep you healthy. Like I tell my kids, the best time to clean your room is when? When it's clean. Right? Best time to take care of yourself is when you're healthy. So if you have a health challenge going on, you need to make an appointment with a healthcare professional at our office, and we have 7 or 8 of them available to help you get back to health. Once you're healthy, you don't need to make an appointment. All you need to do is come to the events. Pretty good deal, right? So what I'm going to do today is kick off the state of the healthcare address, because there's a lot of problems with health in our country right now. Part of it's a system, and part of it's a personal responsibility of you, right? So what we want to do is we want to talk about the problem, but more importantly, show you some solutions we have. So the nice thing with coming here is that you get to work with the owners, Dr. Weiner and I, of Nutritional Frontiers. Anyone taking Nutritional Frontiers products? Yes. Doing well with them? Great. So the reason we started Nutritional Frontiers is because we weren't getting the top quality products that we were demanding. And did everyone see what the New York State Attorney General did a couple weeks ago? Did you see that? No? They tested products from mass market like Target and Walmart. And what did they find in those products? They didn't test out, right? Why is that? Right. Cheap products. What else? Yes. You get what you pay for, right? And when you're looking at herbs, there's extracts where the potency is, and there's a leaf of the plant, right? So when they say ginkgo and they use the leaf, they don't guarantee any potency. That's why they're $5 a bottle, right? So you won't find that with our formulations. Everything we have here is made in a certified lab. That's an FDA-inspected lab. We guarantee everything 100% for purity and potency. Now, you can do that with cheap ingredients, too. It's right. Does a health inspector inspect all the restaurants locally? Yes. But McDonald's sells 100% all beef, and so does Ruth Chris. Is there a difference in the quality? Absolutely, right? So we like to say we're like the Nissan, of the car industry with supplements. You get the highest quality at the best price. Because the difference on our formulas is we use research-based dosages. So you get the right amounts of the ingredients in the right combinations without any of the things you don't want. Plus, we give you different delivery systems. Has anyone tried the powders, the shakes, the drinks, the chewables, the liquids, veggie caps? We give you different deliveries because based on the goal of the formulation and your health condition, we need to provide the best delivery that's possible to maximize your absorption, assimilation, and excretion, right? And then we take tremendous pride in our service. We do 100 days a year for people like yourself and the community, more than any other company is doing. And we just recently, this past Thursday, in spite of the snowstorm, we had 52 healthcare professionals show up for a professional training. So we do a lot of events to help educate because we feel like people are smart enough that you have the right information, you can make an informed, empowered decision, right? So that's the idea of the Wellness Weeks, and that we're able to provide for you the right types of formulas. So I want to see, where does the U.S. system rank in the world? We want to look at where does the U.S. rank, right, as far as health, and then more importantly, what can you do about it? So the U.S. is about 5% of the world's population. How do we know that? 300 million out of 6 billion is 5%. We spend more money than anybody else in the world per person for health care. Is anybody surprised? No. Do you remember when co-pays used to be $0 or $5? What are they now? 35, 40? Some are higher. I picked up one recently for a family member. I don't even know what it was. Picked it up. $64 out of my pocket. $64.50. So I asked the young lady, I says, how long does this medication last? 30 days. I said, I'm paying $64? Yeah. I said, what's the cash price? $400. She says, wow. I said, I could buy a lot of vitamins for $400. I could buy a lot for $64. So the cost is rapidly rising. And we have great insurance. So the co-pays are going up tremendously. My father-in-law, I talked to him recently about it, his co-pay for one medication went from $30 for 3 months to $118. So folks, the costs are rapidly rising. In addition, 5% of the people are consuming 70% of the world's medications. All right, so we're spending more money, we're taking more medications. It should be working, right? Is it? No. Have you ever seen a doctor's office with this many people? Why so many people here? Because this works. Where's the guy? I just saw it here. His daughter had diarrhea for 2 years straight. She came here. Doc put on one product, Paracleanse, because she had parasites or worms. In 2 days, 2 years she had the problem. In 4 days, the diarrhea stopped. 4 days. How long would she have had the problem if she didn't come here? Forever, right? Yeah. It's like if you have a flat tire and you don't fix it, you come back in 5 years, it's still flat. It's not going to fix itself. So prescription drug use is on the rise. Look, if it's something to keep you alive, I'm all for it. But I had somebody recently come in with high blood pressure meds, and she was on 4 of them. Why 4? If one doesn't work, won't you try something different? And also, there's a lot of research that shows walking for 30 days is just as effective as a blood pressure med. Yes. Most people don't walk every day for 30 days. Right? So part of this goes back to personal responsibility, but you got to know what to do, right? So we focus on food, activity, stress, sleep, and customized nutrients. When you address that, it's called a lifestyle program. If you just take a vitamin, it's called green medicine, right? Rather than taking the statin, I'll take the vitamin. Not enough anymore. You got to do it all. And you can take baby steps, or you can dive right in, right? Because if you don't, here's the outlook. 11% of people are taking 5 or more meds. The record that I met with somebody was 23 different medications. I got it from 23 down to about 10. And she felt surprisingly different. She had more energy. She could sleep. She wasn't shaking so much. So prescriptions are on the rise, folks. You need to take personal action. If you don't, here's what the outlook looks like. I've never had anybody take my picture before and say perfect. He's up to something, isn't he? But I'll take it. I'll take any compliment any which way. I'm not fussy. So if you're over 60, and I know nobody in this room is over 60, right? I heard some moaning and groaning. If you're over 60, you're probably on at least one med, and 37% are on 5 or more, right? So are we sick or is it the food? Top cause of death is directly linked to lifestyle. You know, food and obesity now, they just admitted it now. I got research on this now, and it's probably in here. Accounts to 18% of all deaths in the country. 4 times what they had published before. Almost 20% of all deaths are directly linked to obesity. And I know it's not easy. I struggled before. I had issues with thyroid. I was talking to these guys earlier, and they had commented. You know, it took me some time, but it worked, right? Down 85 pounds. It's a big difference. So I understand it's not always easy. It's simple, but not always easy. We're here to help you, because here's the outlook, right? Children, 30% of them overweight. Obesity has doubled in the past 25 years. And now childhood diabetes increased tenfold in the last 20 years. But that's what it looks like, right? Inactivity combined with sedentary lifestyle, combined with junk. It's not junk food. There's no junk food. It's either junk or food. How do you know the difference between junk and food? Natural what?
Natural grown products.
Yeah, it's live grown food, right? You would find it somewhere on the planet if there's no grocery store. And food will go bad if you leave it at room temperature long enough, right? What about Doritos?
Never.
No. Twinkies, they don't go bad.
Anything man-made, pretty much.
Yeah, be careful, right? So if you start looking at it, you realize there's a lot of things that we're consuming that are products, not food, right? So here's the healthcare systems in the world. Who is who? Who's who? Who is the World Health Organization? They come out their stats every 10 years. And the latest one showed that the healthcare system in our country, and we spend more money than anybody, we should be getting the best healthcare, is 37th. What about health? Yeah, it's even worse. 72nd. Now, without looking, could you name 72 countries? I could barely do it with looking, right? It's like I can't even name some of these places. 72 countries. Wow. Birth rates were 13th. How can that be 13th? Right? So the system has been set up to help with what? Trauma and crisis. If you, God forbid, get an accident and split your head open, where do you go? Emergency room, right? Until you're stable, then what do? You run like heck to get out of there. It's the worst place to be if you're not sick. So once you're out of crisis mode, you need to get out. And AMA knows this. How do they know? How do we know they know this? All the way back in 2004, they wrote in the Journal of American Medical Association, We have failed the chronic patient. U.S. healthcare does miracles for crisis, right? For trauma, broken bones, heart attack, stroke, accidents, injuries. No better place to go than a U.S. hospital, right? But what a percentage of office visits are for trauma? You ever think about it? How many times have you been to a doctor or hospital in the last 5 years? How many of those visits are for trauma? 20%. So 80% of the office visits, they can't even help you with. Why? Because the system is set up to help with trauma. They're not set up to help you with a headache. You might as well have your head split open because they can fix that. Had a guy recently comes here, good friend of mine, pretty healthy 55-year-old guy. And he said he has a meniscus tear. He was going in for surgery because he likes to work out, and he couldn't do his workouts because of the tear in his knee. I tried telling him we could help him with the HA+, but he insisted on going for surgery. He woke up from the surgery, and the knee was infected. His blood sugar was almost 300, so he had diabetes now. And he contracted hepatitis. Wow. That's some bad side effects from a knee surgery, right? So the doctor wanted to admit him to the hospital. He called me and says, I don't want to be admitted. I said, well, leave. Came here. Didn't look good. He was getting jaundice. Came back a week later, looked even worse. I didn't think he was going to live. Lost 40 pounds in 3 weeks. And he was scared. You could tell by the look in his eyes. Skin was yellow, eyes were yellow, bad shape. Doc did some of his allergy elimination technique treatments on him. Has anyone had that done before? Yeah. So this is trained by a medical doctor in California. It's called allergy elimination treatment or technique. Fantastic that he's able to do this here. So he treated this guy. We put him on Live Clear 2 by Nutritional Frontiers. Put on a liver gallbladder tincture, sugar salve, greens. You get the idea, right? His concern was that the hepatitis would never go away, and he may have permanent liver damage. They would not be able to tell him for 6 months. So for 6 months, he was concerned about it, right? Worried, concerned. So lo and behold, 6 months just came up a couple months ago. He called me and says, you won't believe it. The blood sugar's under control. The infection's gone. I have no permanent liver damage. And for the first time ever, the doctor has a patient who's been cured of hepatitis. So do you think you can get that kind of treatment if you go to a conventional doctor? No, absolutely not. So here's what's going on, right? Here's the amount of food you can eat in your lifetime, about 136,000 pounds, right? So even if you're eating well, the sheer bulk of the food and the normal metabolic waste products that you create is going to create some damage to your body, right? So not only do you need to eat healthy, but you need to make sure your body's able to break down, digest, absorb, assimilate, means get inside the cells, and then eliminate the waste products. And this is exactly why. And you see, what are people eating? Wow, this is in 1 year. 600 pounds of dairy. I eat very little dairy products. 600 pounds. Seems like a lot, doesn't it? Seems unbelievable, the amount. You look at, cheese, eggs, so a lot of this food, if you look at the vegetables, 415 pounds, if they took away French fries and ketchup, that number would drop. Because they factor it in as vegetables, French fries, and ketchup. So there's the amount of food that people are eating in a year. Now you also have things that affect the gut, right? Anyone here have issues with digestion? Immune issues? Nobody? Skin? Okay. Gut? These are all related because the gut microbia, the balance of the good and the bad bugs in the digestive system has gone out of favor for us, right? Why? Stress, sugar, antibiotics, and even if you don't take antibiotics, where are you getting exposed to them in? Foods, right? Now, I don't mean everyone's depressed. You're all looking here like so sad. There is some good news here, okay? It's not all doom and gloom. So the problem is when you change the ecology of the gut, the good and bad bugs, it's like every neighborhood. You have we all live in neighborhoods, right? I grew up in the city, so it was even closer. You have one or two bad people on the street, right? Everyone has that one neighbor. Don't kick the ball in his yard. He don't give trick-or-treats. He don't put lights up at Christmas. Just that one guy, right? It's okay as long as you don't bother anybody. But what happens if you get 3 or 4 or 5 or more in the neighborhood? And this happens as soon as you move, right? You ever move out of an area and you go back to visit? It's completely different. So this happens in our body with the good and bad bugs. So this can create fatty liver. I think we talked earlier about fatty liver. Diabetes, obesity. This is all connected to the ecology of the intestinal tract. Because we have a pipe that runs from our mouth through our colon, right? So the outside world is traveling through us. It doesn't get inside our body until it passes through the intestinal tract. That's like a screen door. We're all old enough. I didn't have air conditioning as a kid. We had a screen door. And what was the idea of having a screen door? Let the air in and keep out what? The bugs, right? Then we went to my grandma's house, and her house was old, beat up. Nobody lived there anymore than her. And her screen door was ripped, right? So my dad would go and fix it every year. So when the screen door is ripped open, what happens? Yeah, everything comes in, right? So that's the same thing as our intestinal tract. It says increased permeability. That means things get through that shouldn't get through. Anyone ever hear of leaky gut? You guys heard of that before? Autoimmune conditions, have you heard of that? That's what's going on. Things get in the bloodstream that shouldn't be there, and then the immune system says, hold on, foreign invader. And the end result of an immune reaction is what? Pain and inflammation. So a very technical description, but that's what's going on. You have a breakdown in the screen door or the gut. And you have all these different things that can get through the intestinal tract or put too much stress on it that we're exposed to. So we look at this. Pepsi is a leading company in the U.S. health and wellness food and beverage market. Wow. Doesn't even sound right coming off the tongue, right? But look at all the products they make. Gatorade, juice, soda. They're the leading provider. Yeah, water. Is it Dasani or Aquafina? One's Pepsi, one's Coke, right? And then we look at it. The old American high. What's America's favorite drug?
Salt.
Fast food? Sugar. Yeah. Yeah. Because it's more addicting than heroin, cocaine, alcohol, or tobacco. It hits.
Cocaine.
What's that?
My neighbor said it's candy cocaine.
Oh, is that what it is?
She's a nurse practitioner.
Oh,
She says
yeah.
it's candy
Oh,
cocaine.
good.
It's more addictive,
Yeah.
addictive than the drugs.
Yeah. So what happens is that people with stress, they try and feel better, right? And they do this by self-medicating. Sugar, caffeine, or nicotine. You usually have one of those as your favorites, right? And this is saying that it has responses in the brain with reward circuits. So what happens is you almost feel good when you eat that ice cream, right? Almost. And then what happens about an hour later? How do you feel then? Guilty, bad, moody, terrible, right? And a lot of times you may crave this at night because you're trying to get that reaction to help you go to sleep, right? You've probably all been there before. So we need to restore the balance in the brain, and we can do that with the Super B Complete, Calm Day, Control, and the Super Shake or the Best Way, because these have all the nutrients we need to balance out brain chemistry. The sugar almost gets you there, and you come crashing down. So you got to be very cautious of what you're doing nutritionally. Do not skip meals because you will crave these types of foods. This looks at the risk factors for diet, inactivity, blood sugar, right? When you add up those, it's over 1 million people, right? So this goes back to a 20-year study listed in JAMA. Which JAMA? The Journal of American Medical Association. So they found that these are the leading lifestyle factors related to death. The great thing is that you can change it. Oh, here's what I was talking about earlier, right? Columbia University study shows premature deaths from obesity are more than they believed. Almost 20% of premature deaths are linked to obesity. Wow, it's a lot, right? 4 times higher than previously thought about. So what they found is that's affecting us 4 times more than we thought for premature deaths. So you can actually increase life expectancy with decreasing calories. Decreasing food is one of the only ways that we know that you can extend life expectancy. Right? So there's genes called sirtuin genes that have been proven in mice that when you do that, you can actually increase energy and increase life expectancy. So again, we talked about the problem with the diet. 51% is processed foods. 42% is dairy and animal products. Wow. I was going to say, is there any fruits and veggies in the diet? A whole 7%. So think about it. If you don't eat much of those products, there's someone that eats more. There are people that have a great diet. They don't eat any fruits and veggies. 0. And a lot of them come in here because you're sick. So we look at it, GMO, I heard earlier, it's the seeds are genetically modified. The soil is loaded with all these herbicides and pesticides. The growing conditions are changed. And these flavor chemists, they get paid big bucks. Because you can make a food addicting and addicted to the taste. You ever hear people say, my chips, my cigarettes, my what?
Gotta have them.
Yeah, it's like they own them. Oh, I'm not giving up my M&Ms. Because somebody invested a lot of money to make these addictive to your taste buds. Right?
Nestle even used that.
So we got to look at digestion, right? Because this is where health and wealth begins, is in the intestinal tract. The old naturopath saying is death begins in the colon, right? Because if you're not eating live foods, where are you getting the enzymes from? You're not. If you're taking supplements from Costco, you're not getting enzymes. So you need to realize that the enzymes are the most important thing to start the digestion. So where does digestion begin? In the mouth, right? I think you're right, but I want to take it one step further. It begins in the food, because the food is live. You're getting enzymes in it, right? So it actually begins in the food you eat. If you're eating products and there's no enzymes, you're not getting any digestion to start. So really important, you have these stomach acids, and of course the pancreas is going to secrete a lot of enzymes. So really important that these are functioning optimally. Fast forward a little bit. We know this, right? People are larger than ever. What happened in the 80s? What happened in the 80s, 1980s? Cocaine. Oh, where were you hanging out in the 80s?
I was born in '82.
Oh, wow. Okay. So what happened was we went from a typical diet in our country to what? Low fat, right? And what happened when they took the fat out of food? They increase the sugar, artificial flavorings, and what? Salt. I knew I was going to be ready for you soon. Salt, right? And what happened to people? They got fatter. We tripled in size.
MSG maybe too.
Yeah. Food additives, artificial flavorings. Yeah, absolutely.
That's how they fat them.
So fats are not a four-letter word, right? We need good fats. It's just the right types of fats. So we need the right types of fats in the diet. So people are eating more junk food than ever. We know that. Sugar consumption is skyrocketed. People get a lot of weight during the holidays, which you never get rid of. And I realized this when I lived in Florida for 3 years. Up here you gain the weight around the holidays or during the winter, and then you don't lose it all for the summer. And when you do that for 10 years in a row, that can equal 30 to 50 pounds, right? You do it for 20 years, and you can't do it for 30 years because people that big don't live that long. So you got to be conscious of your weight. And what's a great test you can do to see how healthy you are? Hey guys, how about a tape measure or your belt? If the waist is expanding, our metabolism is dysfunctional. If the waist is shrinking or staying the same, we're good. So get a tape measure, about $5, and measure your waist every month to see how well you're doing. So this started when the low-fat guidelines were published. That's what we're talking about. That was 1975 to 1980. And what's happened is they made the food so addicting, and they're trying to make it cheap. I look back at some of my notes from about 10 years ago. And what's that?
Make it cheap and non-nutritious.
Right.
Calorie-rich.
Yeah. So it's got high calories, but low nutritional value, and it's perceived as being cheap, but it's really not. Because those dollar meals that we looked at 15 years ago have now become $5 and $7 or $8. Right? So people are drinking more, not only soda, but what is juice?
Sugar concentrate.
Yeah, it's fruit without all the fiber and the nutrients. So it's soda without the carbonation. Not a good idea. Gatorade and sports drinks, you may need them if you're dehydrated, you're sweating with an athletic event. There's other things you can do that would be better, but I can understand if somebody's sweating a lot that they would want to rehydrate with something like that. Not a good idea. Sodas, of course, not a good idea. And diet sodas are probably worse. So, increased food variety is just leading to overeating, overweight, because you have more and more junk food. And then you factor, we showed earlier, is people aren't working out, they're not moving. I like when it snows. I get out the shovel, get outside, but I don't like when it's cold. But I go to the gym. So you got to be working out. And how much exercise do you need a week? You need at least 3.5 hours a week. Now, I don't include if you walk at your job or you go shopping, that doesn't count. 3.5 hours of where you're working out of some kind needs to be cardiovascular, some strength training, some aerobics, and some stretching.
What about the HIIT, like high intensity?
Look, everything is great and nothing works forever. You ever see someone go to boot camp? They leave, they're kind of soft, and then when they come back, what do they look like? They're in shape. Why are they in shape? Because they're working their tail off. It's not easy to be in shape. It's not, right? It takes a lot of work. Even people that go to the gym may not get great results. I worked as a certified trainer through the American College of Sports Medicine, which is the highest level for personal trainers in our country. Why do people quit working out? Because they get in too good a shape or they don't get any results. Because they don't get results. Why don't they get results? Because their training isn't consistent enough and their diet is not consistent enough. There's no magic pill.
Yeah, one thing I heard is like it's a lifestyle. It's not like a gimmick. It's not something you buy at the store. It's like get out there and exercise like when it's possible.
You got to move.
Stuff, right?
And everyone that works out with me will get in great shape. Why? Because my program's intense enough. So I like the HIIT, I like the training, I like the Fitbit, all these things, but it comes down to, do you consistent? And then how much, is the incentive, is the motivation there? If the doctor tells you you don't lose 30 pounds, you're going to die in 3 months, there's motivation, right? If you have a wedding coming up or a graduation, there's motivation. You got to have motivation. You got to have a purpose of going to work out. But everyone's different, so we try and make it accommodate your lifestyle. Okay, sleeping low calorie, that's right. So I'm just going to fast forward a little bit. Of course, the diet's important, exercise. We got to take some supplements. So we start with the food-based supplements. Anyone do Super Shake or whey protein? Okay. It's a great way to start the day because in the morning you need key nutrients. You need protein, fat, fiber, and water. If you do the shake in the morning, you get those in. What is America's choice for breakfast? Coffee, that's breakfast. Donuts, cereal, bagels, muffins, right? Pancakes, waffles. It's all sugar. Oatmeal would be good. Shakes would be good. A little bit of fruit would be good. Some organic eggs may be good. But you need the good quality of nutrients in the morning because if your blood sugar is balanced in the morning, you're going to do what? You're going to burn fat, you're going to have high energy and no cravings. If you skip breakfast or have sugar, what's going to happen? You're going to store fat, have no energy, and you're going to crave. Yeah, I like unprocessed grains, so steel-cut oats, Irish oatmeal, it's all good. Also, baked potatoes are fine. Yams are fine. Sweet potatoes are fine. Rice can be fine. That's not what's getting people in trouble. That's a bodybuilder's diet. I'll put somebody on that diet and have them work out, and they will lose body fat instantly. Where people get in trouble is processed carbs, right? Breads, muffins, bagels, pastas, all these processed carbs, cereals, it's all sugar. So as I just said, you can change your metabolism. How long does it take to change your metabolism? 3 weeks. How long does it take? I'm going to name that tune, right? How many notes does it take? You can do it in one meal. If you have Super Shake, Best Way, organic eggs, it's going to balance your blood sugar and turn your metabolism on to burn. One meal takes.
What's a super shake, though?
We have it back here. It's vegan, non-GMO, protein, fiber, fats, and we make a smoothie out of it.
Is it like a whey? You got whey in it?
No, it's non-GMO, vegan, no way. No way is there way. No? Yeah.
It comes in a bottle pack there.
Yeah, I'll show it to you in the kitchen. And it's made of pumpkin, pea, and rice protein. So here's a case study with parasites. You see them? Pretty bad, right? There's the parasites 2 weeks later. Pretty good, right? 2 weeks. That's what I want to hear. Wow. All together. Wow. That's incredible. How much money did it cost for the testing to do for this lady? 0. How'd Doc know? He's been doing this for 47 years. Maybe he learned something, right? Here's a lady with joint health issues. So 62, fell down the stairs, sprained foot. And she was using the RICE, which is rest, ice, compression, elevation. And here's what Mike Gallagher, she came to a wellness event, didn't come in as a patient. Mike put her on Symezyme in between meals and doubled her HA+. In 2 weeks, she can walk faster without any discomfort. You may say, well, sprained ankle. You ever see when an athlete sprains an ankle, how long does it take to come back? 6 weeks. 2 weeks. Big difference. So here's a blood sugar case. 61-year-old male, type 2 diabetic, tingling, acid reflux, blood sugar over 200. Here's the medications, and his weight was 248. So he did fish oil 4 a day, sugar solid 4 per day, Prozyme as needed for what? He had acid reflux, GI complete, started walking, and put him on a good diet. That's it. Folks, you got to take initiative. We can help you, but you need to be part of the program. So here he is. He discontinued all his medications on his own. He's down 28 pounds. Tingling is gone. Blood sugars are better. Acid reflux is gone. And energy levels are up. See, we're not shocked by this anymore because we see it all the time. Look at this place. Look how many people here. They're not here because we don't get good results. And the last one, look at this girl. She wouldn't even look at the camera. She didn't have cancer. Her thyroid is shut down. Here's she now. This guy in the bottom in the middle, thyroid disease.
So is that why they don't have any hair? They lost
Yeah,
all their hair?
you lose, yeah. There he is now. It looks like his son. Doesn't he look like him? All right, so any questions on it? We went over a lot of different things. Just want to give you guys an idea where we are, but here's where you can go. So if you need help, can answer any questions one-on-one. If you need more help, we need to make an appointment for you, but at least we get you started today. Doc's going to be speaking in about 10 minutes or so. I'll be here till 5 o'clock if you have any questions. Thanks so much for coming, and make sure you bring people to the next event. Thanks, folks.